My name is David Lotsoff. I am a gastroenterologist and I'm associated with Digestive Consultants. I chose gastroenterology because I wanted the ability to see patients in the office, but I also wanted to be able to use my hands to do procedures. So this allows me to do both. Usually I do procedures in the mornings and then I'll see patients in the afternoons. I went to medical school here in St. Louis at Washington University, and then I stayed at Barnes-Jewish Hospital to do my internship, residency, and fellowship. I love St. Louis. Even though I'm from Chicago, I didn't like the Cubs when I was from Chicago. I was a White Sox fan, so it became very easy for me to come here and root for the Cardinals because Cardinals fans are not too fond of the Cubs as well. And I'm an avid Blues fan as well. I practice general gastroenterology, but I do have special interests in eosinophilic esophagitis, and I'm also very interested in inflammatory bowel disease, Crohn's disease, ulcerative colitis. Eosinophilic esophagitis is a condition where these cells called eosinophils infiltrate into the esophagus and make it less stretchy and less mobile, and so patients can have issues with dysphagia or trouble swallowing. There are certainly a lot of neurologic diseases where people have digestive issues, and we see these commonly, especially in Parkinson's disease, we see that. I've been practicing for now going on 20 years, and so certainly there are patterns that I've seen over the last 20 years which make it a little bit easier for me to pick up on what might be going on. But every patient is going to be different. Every patient has a little bit more of a nuance or some difference in their presentation, and you need to be able to, or I need to be able to sort out how I'm going to approach each individual patient, because even though two patients may have the same disease, the approach to those patients may be absolutely different. I love talking to people. I love dealing with people. I certainly love helping people. But there is certainly an art to medicine. It's not just the same thing every single day or with every single patient. And so those differences keep me very interested in what I do. I chose St. Luke's because I originally started in private practice. And in addition to my experience at Barnes-Jewish Hospital, where I trained, St. Luke's was one of the hospitals I had privileges at. But I've always wanted to come back to St. Luke's because of the people here, because of the patient care philosophy here, and because of the way that we take care of patients at this hospital. I love to snow ski. I love to listen to live music. I read books for pleasure, fiction books. I love to cook. My family loves when I cook Mexican chocolate chili, but I love doing a lot of pasta dishes. I love doing chicken dishes and beef dishes, usually Thai or Indian. Oh, my favorite band's The Doors, but I like all sorts of music. We go to music festivals and we learn different bands. We actually just traveled to Evansville, Indiana this weekend and saw a band called The Cold Stairs, which is actually very good. So if you ever get a chance to listen to them.